A very good afternoon to distinguished guests, ladies and gentlemen. I would like to thank the Hong Kong PolyU WHO Collaborating Center for Community Health Services for inviting me to this event. My name is Pei Lee Teh. I'm a professor from the School of Business, Monash in Malaysia. And I also have the privilege of leading the Gerontechnology lab in Monash as a director. So it will be my pleasure for the next 20 minutes to share with you our community outreach with the age simulation suit and a research on developing empathy towards older adults through emotional and cognitive enhancement, and also a randomized control study undertaken in Monash with the suit. Let me share with you what I think about myself and my future self. So this is the app-generated age progression photo of myself. So I pretty much agree with the saying here. When I was young, I constantly worried about what everyone else thinks about me. When I am an adult, I stop to worry about what everyone else thinks of me. And I believe when I become old, I will worry that nobody else is thinking about me. So in general, older adults are easily overlooked and often discriminated by society due to misinformation, stigma, and also the false belief about aging. So in 2016, I founded the Gerontechnology lab and also launched it with the aim to translate research into new products and services for independent living of older adults. And we want to build a strong network in Asia to shape the public policies. So one of the first devices that we bought was the age simulation suit. It's actually a wearable suit that simulates the common bodily ailments that come with old age. So the suit is a modular design with different parts like goggles, elbow restrictor, back protector, and so on. So in 2017, we took the age simulation suit for a community outreach. I partnered with PetroScience to organize a 2 weeks engagement with the team of Seniors Connected, making technology relevant for the older persons in January 2017 at PetroScience KLCC, the Twin Towers, if you've been to Malaysia. So we had about 2,000 visitors to our event, and one of the activities we had was the age simulation suit. So basically, we had about 80 people willing to wear the suit and completed 5 tasks. First, they read the signboard and walk around in the hot science center. And then they were asked to sit on 2 different chairs, a chair with armrest and the other one without armrest. And they were asked to pick up 4 items from the floor, which is pen, flyers, coins, and golf ball. And the next task was they were asked to push their hair to the back. So for the short hair, they just asked to fix the hairstyle. For the long hair, they will just do behind the ears. So basically, we want to get them to raise their arm. And of course, they were asked to complete a short survey, and we had 76 participants completed the survey. Majority were 16 to 25 years old, and they experienced the limitations in mobility and sensation by doing those activities like picking up the items, and they kind of left them feeling empathetic towards their older loved one. And the top 3 aspects of age simulation suit that surprised participants were: number 1, the apron; second, the goggles; and the third are the elbow wraps, gel glove, and also the wrist weights. So we also asked the participant whether wearing the suit helped them to relate to an older adults in their life and in what way. And the feedback we collected that they could actually connect to either their parents or grandparents in terms of aging. And they finally understood that the struggle that the parents and grandparents face with the age-related issue. And more importantly, they had a realistic view of aging based on their personal experience of using the suit. For example, they know that because some of them couldn't really, do the hair activities because they found that it is not your main muscle hand. You actually lost your muscle when you grow old. So in the same year, 2017, we conducted a lab experiment using the suit. The aim was to develop empathy towards older adults through emotional and cognitive enhancement. So in this section, I will share our research method, results, and discussions. Okay, the latest projection by the United Nations suggests that the world's population could grow to around 8.5 billion in 2030 and 9.7 billion in 2040. Sorry, there's a mistake here. The share of global population at the age of 65 and above is projected to rise 10% in 2022 and 16% in 2050. All right, I'm not saying that we have 8.5 billion people aged 65 years old in 2030. Yeah, so people are living longer, yes, but more importantly, they have a longer time living well. But the changes in economics and social advancement have crippled familiar, cultural, and social institutions. For example, young people are more engrossed to seek for new opportunities and their own identities and kind of forget their sense of duty and commitment towards older adults. And I think you will agree with me that older adults are often stereotyped and also associated with negative behaviors and also attitudes based on their perceived age. So this is what we call ageism, a common form of prejudice which is often forgotten and easily overlooked by society. And our growing dependence on technology risks us, especially young people, becoming less skilled to care and interact with older people and paying little attention to the needs of older people. So for example, every time young people use technology to interpret how somebody is feeling, they kind of outsource to a machine that they could or can do themselves, and this is actually an expensive trade-off. Another example, the more time young doctors spend staring at the digital medical records, actually they have less time they spend looking at their older patient. So aging population needs care from the existing young adults to generate value in service sectors which enhance health, well-being, and social inclusivity among older people. So what is empathy? Empathy is the ability to place yourself in another person's shoe in pursuit to better understand their feelings and also their experiences. And this can be simulated when a person is aware of another person's feeling. So researchers have classified two types of empathy: emotional empathy and cognitive empathy. Emotional empathy refers to the sensations and feelings people receive in response to another person's emotion. And cognitive empathy refers to the ability to identify and understand another person's emotion. So emotional and cognitive empathies are important to serve the aging population in sectors such as healthcare, education, communications, and others. So using the age simulation suit as a proxy of emotional enhancement and also reading the scenarios as cognitive enhancement, this study kind of examines the empathetic attitudes among young people towards the older adults. So our study was built on social neuroscience literature to gauge a better understanding of empathy. So simulation theory proposes that emotional empathy exists when a person notices another person experiencing an emotion, and the person noticing another person simulates the same emotion in themselves to know firsthand what it feels like. And the theory of mind proposes that cognitive empathy exists when a person is able to understand what another person is thinking and feeling through cognitive thought processes. So the preceding discussions led us to develop 5 hypotheses. We had 90 young adults, they are like 18 to 30 years old, completed this study, and each of them was given a token per session, and they were given a choice to either keep the token or donate it to participating nursing and retirement homes. And the survey questionnaire included questions related to their personal details and questions to identify level of empathetic attitudes. So we use age simulation suit as a proxy for emotional enhancement, and cognitive enhancement was achieved by reading scenarios detailing the daily activities. So the participants were randomly assigned to 4 different treatment groups. All participants were required to complete another survey questionnaire after completing their assigned tasks, and the post-manipulation survey had the same set of items on empathetic attitude. So the control group answered the survey question, and the cognitive enhancement participants were asked to read 3 scenarios detailing the daily activities of the older people, which include doing laundry, serving a meal, and also sorting coins, which we saw the picture just now. And emotion enhancement participants were requested to wear the suit and complete the 3 tasks, which is doing laundry, serving a meal, and also sorting coins. The emotion and cognitive enhancement participants were requested to put the suit on and to complete the task, the 3 tasks, and also to read the 3 scenarios detailing the daily activities of the older people. So we have a balance of gender in this study, 48 females and 42 males. This table shows the psychometric properties of the item measuring empathy. In order to test the hypothesis, ANOVA was performed with emotional enhancement and cognitive enhancement as the independent variables, and the difference of the score on empathetic attitude between before manipulation and after manipulations. And our result shows that the main effect of cognitive enhancement is significant, and the emotion enhancement is also significant. Therefore, our H1 and H2 were supported. This slide shows the combinations of the 2 enhancement has a relatively large effect and a simple mean effect between the 2, between no enhancement and both enhancement is significant. Therefore, H3 is supported. And comparison between both enhancement and the solo cognitive enhancement is significant. And between both enhancement and the solo emotional enhancement was also significant. Therefore, H4 and H5 was also supported. So the result shows that emotional and cognitive enhancement were equally important to improve the empathetic attitudes of young adults towards the older adults. And the highest level of empathetic attitude was achieved by the group with the both emotional and cognitive enhancement. And our results are consistent with the healthcare literature, which adopted the suit to mimic the effect of aging when studying the empathic level of subjects towards the older adult, but mainly in the medical school. Therefore, this study is important to bridge the existing perceived gap between young adults and older adults, and to tackle the challenge faced by the aging population in different service-related sectors. From a practical point of view, our findings contribute to the service sector as the older adults will populate the service sector in the future, because over the years, we heavily focus on patient-centered care sectors. However, sectors such as retail, banks, hotels, real estate, education, social work, and media should adopt simulation devices in training their employees to treat older adults as equal. Individuals should come together with a receptive mindset to explore new approaches when they design training program, and also to adopt more creative methods to enhance their service quality. So there are 2 limitations in this study. First, of course, the sample size of each treatment was relatively small. And second, we use self-reported data, and participants may inflate the reported score for the dependent variable empathy. So to address this issue, the dependent variable will be studied in an objective manner. For example, frequency of actions of young adults interacting with the older adults after wearing the suit may be collected in future. Now, in the next year, the following year, 2018, we conducted another study using the suit with the students from the School of Pharmacies. So this study has been published in the Frontiers in Public Health in 2020. Many countries are finding the demand on healthcare system to be a challenge, and of course, WHO has recommended that care for older adults should be centered around their own concerns and priorities. And a lot of schools have made compassionate person-centered care as a core value in their education, their system. And studies have shown that empathetic interaction often lead to increased patient satisfaction, a better patient compliance, and also better quality among patients. So some people have suggested simulation, to use the simulation as an educational approach to teach the healthcare students empathy for older adults. And of course, students gain a better understanding of the functional issues and social isolation that were associated with aging after wearing the suit. And to our knowledge, at that time when we conducted the study, no study has yet to evaluate whether using both simulation exercise and also the aging suit will improve pharmacy students' empathy levels, their ability to respond, and also their ability to use the skills in patient interactions. So this study was a randomized study conducted at Monash between March and September 2018. All the Year 1 Bachelor of Pharmacy students were enrolled in Monash in 2018, were invited to participate in this study. So they were randomized 1-to-1 to receive either intervention or control 2 weeks before the polypharmacy workshop. So all the students were required to participate in a polypharmacy workshop with older adults. And the older adults that we selected were 60 years and above from the local community. And the student have to have 60-minute session with two older adults, 4 students with 2 older adults. And participants were required to assess the older adults' health literacy, discuss their medicine use, discuss the difficulties they face in relation to the medical use, and also to complete a medication list, and also to interact the information or convey the information to the older adults that they interviewed. So we collected the participants' demographic profile and also their score on Jefferson scale of empathy health profession students. I call it Jefferson score at the beginning of the course, which is the week 1 baseline. At the end of the workshop at week 12, all participants completed a 3-part survey. And participants also completed the Jefferson score again 3 months after the workshop, which is in week 24. So the primary outcome, okay, was the change in Jefferson score from the baseline to the end of the workshop, which is week 12. And the secondary outcomes that we are looking forward was the longitudinal impact of the intervention 3 months after the workshop, and the perceived change in attitude, empathy towards and understanding of older adults. But due to time factor, I will not explain the data analysis in this presentation. This is a snapshot of just the participation flow through the study. Our participants had a mean age of 19.5 and mostly female. So in the pre-specific intention to treat analysis, both groups reported improvement in the Jefferson score from baseline with a mean improvement of 1.7 in the intervention group compared to 1.2 in the control group, but this did not reach the statistical significance. So no significant differences between participants' Jefferson score were noted for those randomized to intervention and control group. And 3 months after the workshop, the Jefferson score fell back to baseline levels in the intervention and control group, and also no significant differences. At the end of the workshop, participants' self-rated knowledge and understanding on the physical limitations of aging were similar between both groups, and no difference in self-reported attitudes about the importance of empathy and ability to support the older. That was our result. Yeah. So we analyzed the open-ended responses from 105 participants. That's about 87% of our participants, and we came up with 4 themes. First, lending an ear, a sense of respect, understanding the emotions, realistic view of aging. Of course, participants commented that the polypharmacy workshop provided them with an opportunity to have a practical interaction with seniors, and they know the importance of active listening. And they also understand that a rushed patient-provider interaction was not effective to provide better patient care, and the importance of having a good communication skills and learning other languages or dialect to improve their interactions with the seniors. And this activity also evoked a sense of respect among participants towards older adults, because they realized that older adults really face many challenges in their life, especially related to the medication usage. And we also found the emotion part, where the study provided a practical interaction and helped the students to understand the importance of empathy in healthcare, and also bring up, the importance of different communication skills like verbal and non-verbal communications as a healthcare provider, and also affect their future communication with older adults, like they tend to speak more slowly, use a suitable volume, and also use appropriate tones. And participants had a deeper insight in both physical and emotional issues related to older adults, and they realized why older adults have mobility issues, why they are having difficulties in getting up from the sofa, and also inability to read product information that use small print. So these are very important findings. So our study found that the immersive suit did not significantly improve the participants' self-rated empathy compared to the polypharmacy workshop only, but our qualitative results are in contrast to those from Jefferson score. It revealed one important aspect, which is the personal growth. So the impact of the suit was the most pronounced for the tasks related to flexibility, which was not experienced by the control group, who are only interacting with the older adults. And we also observe and increase awareness of participants in the intervention of the changes, like changes in vision among the seniors. Our study suggests that the use of immersive simulation can be valuable adjunctive learning modality to enhance the understanding of pharmacy students of the older adults' physical limitations. And the suit may be able to allow students to experience role reversal, which students felt as though they were really older and could be an important mechanism to enhance their empathy level. And also provided the students with a personal and professional learning opportunity to think about their attitude towards older adult. And of course, this technique can be easily adopted by the other medical professions like doctors, dentists, and nurses to improve their understanding of the physical limitation of seniors. Now, for research limitation, the suit does not attempt to simulate any cognitive changes associated with aging like dementia. We did not control for other confounder like level of fitness of each student, because the suit was only worn for a short period of time, like 10 minutes, and each of the tasks was only performed once. So future research should ideally examine the impact of using the suit over an extended period of time. And some participants may have lived experience that they could be living with their older adults, and this aspect was not taken into consideration for this analysis. And our study may be underpowered because of the small sample size. And we only conducted this study with the first-year pharmacy students and cannot be generalized to students from other level. And of course, our study assessed only the Jefferson score, which may resulted in the lack of significant findings reported in this study. With this, I end my presentation. I'm happy to take your questions later if you have any.